Epidemiological studies. Epidemiological studies are scientific investigations used to understand the distribution and determinants of health-related events, diseases, or conditions in specific populations. These studies form the foundation of public health research, guiding decisions on disease prevention, health promotion, and policy formulation. An epidemiological study is a systematic approach used to collect, analyze, and interpret data about the occurrence of diseases, their causes, and their effects on populations. In simpler terms, it helps to answer, who is affected? Where and when does it occur? Why and how does it happen? Objectives of epidemiological studies: describe the health status of populations, identify causes or risk factors of diseases, determine how diseases spread or are controlled, evaluate the effectiveness of public health interventions, provide data for policy development and health planning. Types of epidemiological studies. Epidemiological studies are broadly divided into two main types: qualitative observational studies. This is also known as the non-interventional studies, where researcher only observed, ask questions, and formulate hypotheses on the causes of disease and also the mode of transmission. This study is further subdivided into descriptive epidemiological studies and analytical epidemiological studies. Descriptive epidemiological studies. These describe the distribution of diseases and health events in terms of person, who is affected; place, where does it occur; time, when does it occur; purpose, to generate hypotheses about the causes of diseases. Common examples and types of descriptive studies are case reports and case series, cross-sectional prevalence studies, ecological studies. Practical example: a study describing the pattern of malaria cases in Plateau State from 2020-2024 by age, sex, and season. Analytical epidemiological studies. These investigate the determinants or causes of diseases by testing hypotheses generated from descriptive studies. Purpose: to identify associations or causal relationships between risk factors and health outcomes. Types A. Case control study compares individuals with a disease cases to those without controls. Looks backward in time to find exposure to risk factors. Advantages: quick and inexpensive. Useful for rare diseases. Disadvantages: prone to recall bias. Cannot measure incidence directly. Example: comparing children with cholera cases and those without controls to determine if they drank water from the same source. Cohort study follows a group of people over time to see who develops the disease. Can be prospective, follow into the future, or retrospective, use past records. Advantages: establishes time sequence between exposure and disease. Measures incidence and risk directly. Disadvantages: expensive and time-consuming, not ideal for rare diseases. Example: following factory workers exposed to asbestos for 20 years to observe if they develop lung cancer. Cross-sectional study examines exposure and disease status at one point in time. Advantages: quick and inexpensive. Good for measuring prevalence. Disadvantages: cannot establish cause and effect, temporal relationship. Example: a survey on the prevalence of hypertension among adults in Jos City in 2025. 2. Experimental studies. An experimental study is a type of epidemiological study in which the researcher assigns subjects randomly to different groups, for example, an experimental group and a control group, to determine the effect of a specific exposure or treatment on health outcomes. In short, the researcher does something to one group and compares the result with another group that did not receive the intervention. Key features: manipulation. The researcher applies a treatment or intervention. Control. A control or comparison group is included. Randomization. Participants are randomly assigned to groups to reduce bias. Blinding. Participants or investigators may be unaware of the group assignments, single-blind or double-blind. Types of experimental studies. A. Randomized controlled trials, RCTs. The gold standard for experimental research. Participants are randomly assigned to experimental group, receives the intervention, enjoy, a new drug, vaccine, or behavior change program. Control group, receives placebo or standard treatment. Outcomes are compared between the two groups. Example: testing a new malaria vaccine by giving it to one group of children and a placebo to another group, then comparing infection rates. B. Field trials. Conducted among healthy people in the community to test preventive measures. Example: a study testing the effectiveness of a new mosquito repellent in preventing malaria. See community trials. The unit of study is an entire community or group, not individual people. Example: comparing two towns, one with a clean water program and one without, to see differences in diarrheal diseases. D. Clinical trials conducted among patients in hospitals or clinics, used to test new treatments, drugs, or medical procedures. Example: Evaluating the effectiveness of a new antibiotic for treating tuberculosis. Steps in conducting an experimental study. Formulate hypothesis. Select participants. Randomly assign groups. Apply intervention to experimental group. Use placebo or standard care in control group. Follow up participants. Measure and compare outcomes. Analyze data and interpret results. Advantages. Provides strong evidence for cause and effect relationships. Randomization reduces bias and confounding. Results can guide public health policies and clinical practice. Limitations. Can be expensive and time-consuming. May raise ethical concerns, especially when withholding treatment. Sometimes not practical for large populations or harmful exposures. Participants may drop out, affecting results. Examples in public health. Polio vaccine trial, 1954. Tested the Salk vaccine in millions of children. HIV prevention studies. Testing pre-exposure prophylaxis, PrEP. Smoking cessation programs. Comparing effectiveness of counseling versus nicotine patches. In epidemiological studies, researcher can either use a qualitative or quantitative epidemiological studies.